All right, I guess let's jump into some interesting. This is kind of a first two segments is for teens, and then the last one's kind of rated R almost. Not that there's like anything crazy, but yeah, this is kind of a spicy topic. Maybe a little bit polarizing. I'm interested what you guys think about it, if you're willing to say. And this comes from some recent news from the new Trump administration, and this one's about antidepressants usage with teens and adolescents. And I kind of want to dig into like what the current trends are with this and why there's a little bit of scrutiny. And this comes from a recent announcement. I don't know if you guys saw this. I mean, there's so much stuff coming out of the White House right now. It's impossible to like remember it all. But some of the things that are concerning healthcare I take note of. But Trump asked the new health secretary, RFK, Robert Kennedy. I guess everyone knows. You guys know what RFK means, right? If I say that. Like, does everyone know RFK?
Yes.
Okay, RFK.
I hope so.
I guess. To assess the threat. So they assess the threat posed by children by antidepressants such as SSRIs, antipsychotics, mood stabilizers, and stimulants, as well as some weight loss drugs. And so, I don't know, I figure anytime the White House puts out something, it's always just people on both sides going kind of crazy. And this was pretty similar. There were some people that were panicked that they're, worst case scenario, they're going to ban these things and people aren't going to be able to get their medications, which I don't think will ever happen. And you had other people that were really excited about it because they feel like these medications are either harmful or more moderately, they think they're just being overprescribed.
Yeah, I can see the overprescribed part.
So, okay, what do you guys think about that? Is that something, so I'll tell you, like, as a physician, there are a ton of physicians that think that SSRIs specifically are overprescribed.
What does that mean? What does SSRI mean?
So like Prozac is a really popular one. It's an antidepressant. It's a class of, and I'll explain what they are in a minute, but it's that class of antidepressants like Zoloft and Prozac and I can't remember all the trade names. Do you guys have that feeling that we use a lot of antidepressants here in the United States? Is that like something the general public like thinks about, or is it just medical people?
I don't know. I mean, I've gone to therapy before, and the first thing they ask is if you want to be on medicine.
The first thing they ask?
Yeah, whenever I was like going
to therapy. That's interesting you say that.
They're like, so are you looking for help?
Like, do you want to try medication?
Yeah, do you need to try? And I was like, no, that's why I'm like,
that's why I'm here, yeah.
Talk to you,
yeah,
talk it out.
It's very interesting you mentioned that because that's absolutely one of the things I'm going to talk about. So, I want to give like a very neutral opinion to this. Like I'm not, as always, I am usually kind of in the middle of any kind of debate, because I try to see like all the pros and cons. There's been a lot of,
I didn't say anything.
Oh, I thought maybe it was troubles in my eye. I'm hearing things.
Ghosties out here.
It's the voices. So, there's been some really wild claims about SSRIs. One of them was that kids on SSRIs increase the risk of school shootings, which has been proven false. I mean, there was actually looked into. There was a article in 2019 from the Journal of Behavior Sciences Law that looked at all of these incidents with violence in schools, and they couldn't find any correlation with the antidepressants. So that's been kind of debunked. But there are a lot of people that have taken note that these medications have exploded in the United States. And not just with adults, with children as well. The United States leads the entire world in antidepressant use.
Yeah.
Have you guys heard that one before? Mm-mm. Yeah. And they lead by a lot. There's one country that's actually pretty close. All right, what would be your guess for the country that's actually close to the United
Canada.
States? And that's a good guess, but incorrect. They're pretty high as well. Travis?
Russia?
No, it's not Russia. They actually, theirs is pretty low. It's Iceland.
Oh, wow.
I don't know why. Maybe it's because it's so dark up there. That may have something to do with it because it's very high. And so they get these, they get that all-day sun in the summer and then all-day night.
Are there like native people that still live there?
Icelandics, yeah.
Oh.
I don't know where they're originally from or if they've been there for a million years. I don't know. But there are Icelandic people.
Oh.
Yeah.
It seems like somewhere you'd go for research or something.
That would be Greenland.
Oh, okay.
Yeah. Greenland has like 20,000 people. I think Iceland's they have like a legit population.
Okay.
I don't know how many, but I've always wanted to go to Iceland. It sounds like a cool place. I keep waiting to see if there'll be a music festival there that I could like make an excuse to go. But
What?
So far, no.
A music festival?
Yeah, we travel
And then
for
you'll
music.
go.
Oh yeah. You've got a reason to go. So Iceland is the only country that's close to the United States in antidepressant use, and they are pretty close. But there's a lot of developed countries where like the use of antidepressants is half, which I mean that's a pretty staggering difference. And the use in children and adolescents has actually gone way up. There's an article from the Journal of Pediatrics in 2024 that looked at the antidepressant use in teens from 2016 to 2022, so 8 years. So in 8 years, the amount of prescriptions went up by 66%. That's a lot.
Yeah, I think to me, I guess it's because it's like normalized to go like, oh, let's go to therapy, like that's normalized, right. And then so more people are going to therapy, and so it's kind of like likely to think
all,
that
it's all kind of lumped in together.
Yeah, that you'd get prescribed more because there's more people going to therapy because that's more like openly a thing now.
Yeah, and I'm gonna talk about that because that's like one of the gripes that the critics of the kind of the big antidepressant push have is what the stepwise should be. So you were asking about SSRIs. So that's selective serotonin reuptake inhibitors. So like the big ones are like Prozac, Zoloft. It's like the very most popular class of antidepressants that are used. And what they do is they block the normal reabsorption of the neurotransmitter serotonin. So normally, if our brain releases serotonin to affect our mood, once that neurotransmitter hits a receptor, then it's dissolved, okay, or reabsorbed. And so what SSRIs do is they block that reabsorption so that serotonin still hits the neurotransmitter receptor, but instead of getting destroyed, it's re-released and then it can hit another receptor. And so basically SSRIs will increase the amount of serotonin in your brain, and serotonin regulates mood, regulates sleep, regulates a lot of things that are related to depressive symptoms. And it's very, very clear, this has been established many times in the literature, that increased levels of serotonin dramatically improve symptoms of depression.
Right.
Like that's not up for debate. Like that is absolutely a true fact. It can also decrease in anxiety, improve your mood. It's been shown to have a lot of very notable effects in the brain. I should tell you though that it does work best for severe depression. And this is getting into like, okay, who should get medication or who shouldn't. I mean, ideally SSRIs work best for people with severe depression. And also it should be known that it does take several weeks to work. This is not a medication that you take and the next day you feel better. It takes time for that serotonin to like increase in your brain. But there are, why is that important? Well, if people have untreated depression that's severe, like their risk of suicide is quite a bit higher than the normal population. It's like 5 times higher than the general population. And so that's why these drugs have been thought to be like so great, because we know that people with severe depression have dramatic increased risk of suicide, and these medications absolutely help that. And so hence, they are, they're thought of being really good drugs. But they do have some side effects. Most of them are mild or temporary. It's kind of like the GLP-1 agonists that, if you start them, you're going to have some side effects, but generally they go away. It's insomnia, headache, nausea, diarrhea, joint pain. Probably one of the most talked about is sexual side effects. People that take SSRIs will note that their
like their libido's down.
Their libido's down. Sex is less fulfilling. It's not everyone, but it's a notable amount of people. And one of the biggest reasons that people stop these, there is a little bit more serious risk of bleeding, especially if people take other medications like aspirin. And probably the most dangerous is there is a very rare, very small chance that initiating these medications will increase your thoughts of suicide. Which is obviously bad.
A lot of my family members take that stuff.
Do they?
Yes.
Yeah, you have to be a little bit careful when you first start taking it because it can mess with your brain a little bit.
Some of them have been taking them since like they were in high school.
A long time.
Yeah, so I'm like, that stuff has been around me a long time.
Yeah, you just kind of grown up around it.
Yeah.
The one thing that kind of brings us back to the use in teens and adolescents is the research does say that people younger than 25 have a notably increased risk of having that suicidal ideation when they start these medications. However, it's still small. It's not like a huge number, but it is there. And so, the debate over this, I think, has merit because when you look at the explosion of these drugs and the fact that other countries are not using them in the same numbers that we are. I think that the people who question if they're being overprescribed are correct. And the biggest complaint that I think is legit is that they're being prescribed too quickly and potentially to patients that have more mild symptoms where
That
other
just
forms
need
of
to
therapy.
like have some lifestyle changes.
Correct. You're
Yeah.
exactly, Sarah, that's exactly right. Because
It's the same thing with their health though, like nutrition wise,
right,
physical.
versus starting, Ozempic or something.
Yeah.
Yeah.
It's the same thing.
And so, yeah, it's just a matter of like degrees, right? And so people who have more mild depressive symptoms can often benefit greatly from lifestyle changes or, therapy.
Yeah, increased therapy. Yeah.
And so, that's thought of as being better than starting on medications. In fact, there was a 2023 study in the Journal of Psychiatric Research that showed that a lot of prescriptions for these medications were given after just one visit, which means that they're not trying other things.
Yeah.
You know?
I mean, that's similar, I feel like, exactly to like how
Yeah.
Ozempic is prescribed. And you were
Yeah,
saying
it
like
is
how
I think it's right. I think it is being overprescribed.
Yeah.
Ozempic is because I know people that are taking it, and I am not giving prescriptions for that, but I know people who want to lose like 10 pounds that are taking Ozempic. Like that's crazy.
Yeah.
It's like overkill, right? And so I think that these medications are also kind of being used in that way. So the big question is like, what's going to happen? Is this investigation going to result in any changes? I mean, who knows? I mean, I think that these drugs have been investigated a lot, and I don't think they're going to find anything earth-shattering. I think the chance of these drugs getting banned is like zero. I mean, all of the research shows that they're extremely helpful. Are they being overprescribed? Maybe. I think if anything, they may find that
maybe they need to do some like prevention for childhood, like things that like trauma that most likely happens in your childhood that results in.
And people getting on the meds?
Yeah.
Yeah, I think
feel
that,
like it's like a
better
parental
mental health
thing.
services, I think, are probably going to be an outcome of this. Like, better mental health, maybe more guidelines about when you start the drug versus when you maybe try therapy or lifestyle changes.
Yeah.
I don't necessarily have a problem with them looking into it. I think they kind of are going about it in kind of a negative way, saying, oh, what's this big threat? Well, I mean, I'm not sure there is a big threat. Could they be streamlined or used better? Probably. Yeah, I think so.
Yeah.
But are they going to find some smoking gun thing?
Yeah, they're
I
not
don't
going to
think
get rid of them.
I don't think so, no. But it is interesting. I think it's a good thing to discuss. I think that there's a lot of parents out there that, have kids and, if they're having issues, these things get brought up. And, I think having like a baseline knowledge of it is a good thing. So that's why I thought it'd be worth kind of talking about, and especially since it's been in the news. So we'll see what happens. We may have to do a follow-up once they kind of do their investigation.
Maybe this new generation of people getting therapy will create children that are not being like re-traumatized.
Yeah.
Like the generational
It'll get
trauma.
better.
Yeah.
Maybe. Yeah, maybe so.